Hi, everyone. It's an absolute pleasure to present our team's work on using ratio of economy of motion to assess trainee autonomy during dual console colorectal procedures and does gender matter. So we have the following two disclosures. So, talking about the background of our research, increasing operative autonomy is critical during surgical trainees, as it helps trainees acquire both technical and non technical skills that are required for an independent surgeons. But there are a lot of factors that can influence autonomy, ranging from procedural complexity to institutional policies. And recently, evidence shows that social and cultural factors, including the gender of the trainee and attending, might also have an impact. And there are numerous studies that have shown gender based disparities in operative autonomy. Despite the importance, the current assessment tools are subjective, time consuming, and also susceptible to assessor bias. So, this underscores the need for a more standardized and objective tool to assess operative autonomy for trainees. Interestingly, robotic surgery gives a unique opportunity to collect objective surgical data, as there's a computer software between the patient and the surgeon. Then we have objective performance indicators, also known as OPIs, which are derived directly from the robotic system data. An analysis of these can offer objective data regarding surgeon autonomy, movements, and surgical workflow. One way to classify OPIs is by type. One of the type is event metrics, which gives information about how many times surgeon used the clutch or moved the camera. Next, we have kinematic metrics, which gives information about how fast or jerky was the instrument movement. In addition to these two, we have time, wrist articulation, smoothness, and energy metrics as well. Another way to classify OPIs is by source or location, for example, whether they're coming from the surgeon console or the patient card. Recently, our group introduced a calculated OPI that's known as the ratio of economy of motion, which can help assign consoles during dual console procedure. So this is how it looks like. It looks very scary, but it's very useful as it helps us assign each step of the colorectal procedure to either the attending or the trainee. Our aim was to conduct a feasibility study using ratio of economy of motion to identify differences in operative autonomy between male and female trainees during dual console colorectal procedures. We captured endoscopic videos synchronized to robotic system data during 87 dual console colorectal procedures. We then annotated those videos to delineate individual surgical steps using an annotation card. And then using ratio of economy of motion, we assigned each step to either the trainee or the attending. And then autonomy was compared between 6 female and 4 male general surgery chief residents, as well as 1 female and 3 male colorectal surgery fellows. So this is how we collect our data. We have a data recorder that's present between the surgeon and patient, and we record everything that's going back and forth. This is how our annotation card looks like. For each step, we have a description and start and stop parameters which are used to annotate those videos. In terms of our study cohort, most demographic variables such as gender, age, BMI, as well as diagnosis were well matched between DCPs with male trainees as compared to the DCPs with female trainees. So now I'll be talking about the results. In the following tables, you will see that we have our comparison group in the first column. We noticed some differences in operative autonomy based on the procedure type. During all DCPs and robotic right colectomies, we found that male fellows performed more steps per procedure as compared to the female fellow. We also looked at the impact of attendings' gender on autonomy, and we found that during all DCPs with male attendings, male fellows performed significantly more steps as compared to the female fellow, and during robotic right colectomies, all male trainees, including both the residents and fellows, performed greater steps per procedure. In terms of female attendings, we did not find any significant difference at all, and we were not able to compare the right colectomies as only male trainees assisted in those procedures. So in conclusion, it's a pioneering study that uses a novel OPI, which is known as ratio of economy of motion, to objectively assess autonomy. We found that male fellows exhibited greater autonomy, but we need more cases to make definite conclusions. But interestingly and importantly, this study supports the feasibility of using ratio of economy of motion to track autonomy and consequently assess attending entrustment. And it can help inform more equitable training practices. Thank you so much.